What's cooking, everybody? It's Ryan here, and welcome to our 15th Mnemonic in Internal Medicine. I greet you in the powerful name of my Lord and Savior Jesus Christ. We're breaking into the discipline of cardiology, and we're starting off with precipitants of cardiac failure. The mnemonic is failure. Ever wondered, why do cardiac surgeons make the best public speakers? Because nobody else can touch as many hearts as them. Did you hear about the heart that went to jail? Reporters say it was cardiac arrest. Right. Okay, so let's dig into this, guys. So the first portion has to do with F, which is these patients fail to take their medications. These are patients with known LV dysfunction who are on diuretics and ACE inhibitors and beta blockers and aldactone and ivabradine and ARNIs, and they just fail to take the medications, so it speaks to non-adherence, right? A is a two-pronged one, which can stand for arrhythmia or anemia. So in clinical practice, the most common arrhythmia we see is atrial fibrillation. And a mnemonic to remember the etiology of atrial fibrillation, which we'll probably cover in another video, is MATCH. M is mitral stenosis, A is alcohol, speaking to the holiday heart syndrome, T is thyroid disease, C is coronary artery disease, and H is hypertension. All right, so it's good to do an ECG and rule that out. And clinically, atrial fibrillation, as we know, will manifest with an irregular pulse, significant pulse deficit, absent A waves in the jugular venous pressure, variable intensity of the first heart sound, and it classically worsens when the patient exercises. All right. So the other A is for anemia. So we know anemia we classify as being micro, macro, or normocytic. And commonly, what precipitates anemia is blood loss. So it could be menstrual blood loss, it could be gastrointestinal blood loss in the way of peptic ulcer, gastritis, or something in the lower GI tract. So, if this blood loss is chronic, it'll manifest with a microcytic picture. If it's acute, commonly a normocytic picture. Or if there's reticulocytosis, a macrocytic picture. And B12 and folate deficiency as well. It's always prudent to do iron studies, B12, folate, do a scope, upper and lower scope, or gynae assessment if you're unsure as to the cause of blood loss. I stands for infection, any infection really, but commonly in our setting pneumonia, and watch out for COVID as well in patients with LV dysfunction. Ischemia and infarction. So here, typically the patients may complain of retrosternal crushing chest pain. You want to get that history as well as do an ECG, which may demonstrate ischemic changes in the way of ST depression, T wave inversions, ST elevation, Q waves, etc. And do your cardiac enzymes to determine whether there is indeed a troponin leak. Lifestyle has to do with increase in salt intake, really. U is upregulators or thyroid disease. So both hypo and hyperthyroidism can precipitate heart failure as well as pregnancy, especially in the second trimester. If there's an acute rheumatic valvular lesion, that can cause heart failure or precipitate it. And E stands for embolism. So you're thinking about pulmonary embolism, especially if the patient has a high well-scoring index, has a DVT, or has a raised D-dimer, in which case you want to do a CT pulmonary angiogram and or VQ scan and commence anticoagulation. All right. So quick fire again, guys. Precipitants of heart failure: non-adherence, that's F, fail to take meds. A is for arrhythmia, commonly AF, but any arrhythmia really, and anemia. I sleeps to infection, ischemia, or infarction. L is lifestyle. U is for upregulators, both hypo and hyperthyroidism and pregnancy. R is rheumatic in the way of any acute valvular lesion. E stands for embolism. God bless you and have yourself a beautiful day. I'll see you tomorrow.